Can I get you to say and spell your name, please?
Chris Raftery, Raftery,
And your title?
Nurse Practitioner at Gold Coast Hospital, Gold Coast University Hospital Emergency.
Cool. Everyone's happy? All right. So, Chris, tell us how this program works.
The emergency department has patients which come for various demands and needs, and one of the innovative ways that we've tried to meet the demand is to have senior registered nurses who train and become qualified to provide extra benefits. So the nurse practitioner role, which is all of us, are able to see and treat, are able to diagnose, prescribe medications and refer people onwards as needed, and be able to just keep people moving through the emergency department and treated quicker and more efficiently.
How do you sort of get those skills? Because I guess it kind of takes you a little bit on par with what the doctors in the emergency department are doing.
So it takes many years. We mapped it out, and you need at least 6 years of senior experience as a registered nurse, and then there's about 6 years of education collectively that goes on to actually get to the stage where the national board then endorses you to have these credentials. But it's certainly something. There's just over 1,000 nurse practitioners across Australia now, and emergency is the largest cohort of nurse practitioners. And there is many things, gaps which we're filling and being beneficial with our experience to the table, and being able to have patients treated with better care and keep up with the demand of the emergency department and other aspects of the service.
How many people go through this emergency?
So each year we have, I think, almost 90,000 people within this emergency department, and we have 6 nurse practitioners that work across here in Robina, and between the group of us we certainly see a majority portion of the minor injuries and illnesses, and certainly see that a little bit more efficiently and quicker without getting caught up with hospital processes of people needing admission and long-term diagnostics.
Is there a difference in the patients, what they see? If they're coming in all out with some nurse practitioner,
So it's quite interesting because wealth of experience, especially in emergency, is something that we provide exactly the same care. We have exactly the same knowledge base, but we do it with a smile on our face. And those things you know as a nurse, we're able to provide those extra steps which give that more complete experience. The patients that we do see are very well cared for under our care, and we actually are able to, knowing the system and knowing exactly what needs to happen to these people, we're able to navigate through the health system with our experience and provide them the best care possible. And that's in comparison if you look at junior medical officers that regularly rotate through the emergency department. Their experience is very clinical but not focused towards emergency requirements, and so that's where our wealth of experience comes in to get the right things done, and having those extra abilities of being able to diagnose and prescribe and refer are those extra little facets that just close the loop to enable us to give that complete service.
is this a thing that's going on a bit overseas as well? I've seen in other countries, the UK and the US, there's a lot more nurse practitioners.
Yeah, so the nurse practitioners commenced in the States about 40 years ago, and through each different state over there, they've got different requirements, and they certainly fill that gap in service where you've got highly specialised medical personnel and registered nurses who also play a big part, and that's certainly been something that's been very successful in the States. The UK is similar, where they've played a vital role. So in Australia, for about 12 years, we've had nurse practitioners, and we've slowly built our strengths. And as I said before, emergency is certainly the largest cohort of nurse practitioners, but we feel that we certainly are able to manage patients and treat their healthcare needs very effectively.
Do you think that it should be rolled out to hospitals in general, like not just the Gold Coast Hospital?
So,
Sorry, Chris, can I get you to stay face? Try and answer otherwise we'll get a really side profile.
So there's, as I said, approximately 1,000 nurse practitioners across Australia, and about a third of those are to do with the in emergency. And so this hospital, the Gold Coast Health Service, is certainly looking at trying to be innovative and create lots of opportunities for nurse practitioners. We have 14 nurse practitioners in the Gold Coast Hospital across a lot of specialties at the moment, we certainly are looking at expanding those in various other parts of the health service, as well as what we do here in emergency.
Obviously, the idea is to get people through emergency or that department quicker. What sort of results are you already seeing in terms of saying being able to, can you discharge patients?
So the whole pathway for a patient can actually be from start to end wholly managed by ourselves with no input from a medical officer. And there's a large cohort of patients that attend the emergency department that are very well managed by us. The positive benefits is oftentimes there'll be a quicker throughput, the waiting times will be less, and we've done a lot of reviews on the position over the years, and the percentage of people that actually have to return to the emergency department unexpectedly is fairly minimal, and the level is actually lower than what it is for medical officers. So we've had a great success rate of our ability to accurately and appropriately manage patients.
No doubt there's a fair bit of criticism of the idea of some people, they want a doctor.
Yep.
How do you deal with that?
I had an incident the other day where I had an elderly gentleman who called me doctor. I corrected him and explained how I was a nurse practitioner, and I had gave him the quick rundown of what I did. He was very overwhelmingly thankful for my input, and at the end of it called me doctor on his way out the door and said he was going to tell his GP that I'm much better than him. So the community, while they do have some expectations, from what we see from a lot of our experiences is that they have healthcare needs that need to be addressed, and if that can be addressed by someone alternate to a doctor, the traditional person you go and see is a doctor, but they're quite happy and very willing to have us as their treating clinician.
Is there a need for nurse practitioners at all, with maybe increase in some EDs seeing more patients who might need to turn up to an ED?
Absolutely, because the cohort that we look at is very much the minor injuries and illnesses, and people that are unlikely to be in admission to hospital with a lot of complex diagnostics and procedures. And so that is certainly a cohort that has come a little bit from general practice over the years, and we're filling a bit of that void there where we're providing that service as part of the hospital, and are able to also give people that reassurance when they may not need to be in the emergency department, that giving them that feedback on their health system and what the follow-up may be required from there, and that their GP may be appropriate, or other health services we often do provide that feedback.
Do you want to go into any controversy and say if you think this might increase with the GP co-payment, or if you don't want to go there, that's all right?
That's a very much contentious issue at the moment, and I think that's one of the things that we've found in emergency over the last number of years, with not just having this co-payment, but also the changes in bulk billing services over the last 5 to 10 years. So the emergency departments have had such an influence. We've had a doubling of presentations over the last 5 to 10 years, and it's really whether it be appropriate or not, we're happy to sort of fill that gap and be able to give them that reassurance that their health is okay.
Do you think that patients are more reassured having to just potentially deal with one nurse?
One of the things that we've had a lot of good feedback on is that people actually sometimes will request to see us. So return visitors who have had a complete and thorough experience with us in the emergency department do see a lot of benefits of actually just having us as a one-stop clinician and being able to provide everything. But it's just having that time to provide that little bit of extra thought and services around where someone may live. They may live by themselves and just have a broken arm, but may not be able to cope at home. Going through those extra little bits just closes that loop and gives us a better experience with their healthcare.
Thanks very much.
Thanks.
All right, no worries.